All right. Good evening, everyone. It's my pleasure to have you today on today's Safeoclock Health and Safety Interactive Workshop. So we have a topic that we are discussing today. We are talking about tinnitus. And this week, or just last week, is the awareness week. So we'll finish our weekly workshop before the awareness day started. But we discussed the awareness week today and look at some of the impacts of the awareness and how we are supposed to be part of it going forward as health and safety professionals. So first, let's understand what is this tinnitus we are talking about before we start looking at the awareness, how they create the awareness, and the impact it has in the society so far. So tinnitus is a medical term that is used to refer to ringing in the ear. And this happens as a result of maybe trauma. It can be as a result of exposure to the noise, a long-term exposure to high noise in the workplace, or even in the office, or even in the church. So continuous ringing in the ear is what medically they refer to as the tinnitus. So it's a perception of continuous ringing in the ear without external source. So those ringing can be in the form of ringing like a bell, can be in form of buzzing, it can be hissing, it can also be in form of clicking or roaring in the ear. So the people that has this condition, they continuously hear sounds inside the ear, even while there is no external sound. Let's say after the music has finished playing, they continue hearing those sounds, those tinglings inside the ear. So that is the medical condition that is referred to as tinnitus. And it originates mostly from the workplace because of exposure to the work. It can also be as a result of damage to the ear, maybe heavy slap or maybe impact to the internal part of the ear, like the eardrum or the inner ear. So when this happens, we say tinnitus is present. So people that have severe tinnitus, they can also have trouble concentrating and sleeping. So when you have this continuous ringing in the ear, you will lose concentration. You will not be able to concentrate, and you cannot be able to sleep properly. So that is what happens in tinnitus. So over time, it can lead to depression. You know, when somebody is not able to sleep for a long time, and the next day he has work or he has activities, so he can not concentrate, he will lose productivity. Then at the end or at the far end, he can be depressed, can lead to thoughts of suicide. All this can come in place because of just a tinnitus experience. So that is why it's an issue, and it's a serious case that we are paying attention to it now, because maybe over time it has not been recognized as a health hazard. So let's look at what this awareness week is all about. So Tinnitus Awareness Week focus on the effort to shed light on this medical condition. So the effect is on over millions of people worldwide. A lot of people are experiencing this. So throwing this awareness open, letting people have time to discuss about it, so that the experience that some people are passing through, they will know that it's not unique to them. It's something that has a name, and it's something that can be managed, and it's something that is readily diagnosed, or something that can be easily taken care of if you understand what the symptoms is all about. So this awareness brings to light this situation that millions of people are suffering from, and throwing it open, reducing the maybe people getting criticized or people getting doubted because they say they are having ringing in the ear. So if we make this awareness open, when somebody says something like this is happening to him, then it becomes obvious fact that tinnitus exists. So during this week, organizations, companies, health and safety professionals can decide to organize workshops, can decide to speak to people individually. You can decide to organize webinars, seminars, or even promote strategies for management and for coping with tinnitus for people living with this condition. So that is why this awareness week is very important, and that is why we are talking about it today as well. So for this awareness week, it happens every year. It happens in the first week of February every year. Okay, so for this year, 2025, it started from 3rd of February and ended on the 9th of February. So first week of February every year is Tinnitus Awareness Week. And as health and safety professionals, it's part of our duty to make this awareness known to the workers, known to our organization, known to other people around us. Now, the week is an opportunity for us to come together, support people who are affected by tinnitus, and also work towards ensuring that the treatment solutions are readily available. When we raise this awareness, we're able to gather statistics, we're able to gather numbers. Especially in your workplace, you can decide to throw up the statistics. You can ask how many people are passing through this, or through your medical team, through the maybe the nurse or the site nurse, the occupational nurse. So they can have an assessment of everybody in the workplace, able to keep record, have statistics of the number of people who have experienced these symptoms or who are complaining of these symptoms. So that will help for proper research, for proper diagnosis, and for adequate action. Let's take, for instance, in your workplace, you did this survey, and you find out that over 50% of the workers have symptoms of tinnitus. What does that mean? It means that there is the activities that they're exposed to high level of noise, and that is having a lot of impact in them. And that calls for immediate action. So that is part of what this Awareness Week brings to light. And that's part of what this Awareness Week helps us to establish. So the history of tinnitus in UK started from British Tinnitus Association. They started this awareness, and over the years, it has spread across UK, and other parts of the world have taken cognizance of the importance of raising this awareness. So that is why we celebrate this week. Now, let's look at some of the impacts in UK. There is a forum known as Tinnitus UK. So the Tinnitus UK, they've conducted a research that established some facts about people experiencing symptoms of tinnitus in UK. So what they do is, they are an organization that have members, voluntary memberships, they have volunteers, they have registered members, and the lead or the head of this Tinnitus UK also suffers tinnitus himself. So this was like a motivating factor why he established this forum. So in this forum, they have a lot of volunteers and they have a lot of registered members whom they are able to take care of. They research, they promote awareness. They even went to as far as going to the House of Commons to raise awareness and demand for adequate inclusion of people living with tinnitus. So this is what Tinnitus UK is doing. And from their research in 2023, they they brought together 478 people living with tinnitus. So in their experience, they find out that 1 in 5 respondents experienced thought of suicide. So one out of 5 of people who we are examining or who responded to this survey, they said that they've had thought of suicide because of the symptoms or because of the discomfort they experience from tinnitus. So another thing that another fact from their research is that 8 out of 10 people, they reported low mood or anxiety, with 5 out of the 10 feeling hopeless and helpless. So because of the symptoms of the tinnitus they face, this number of people always have mood issues. They have anxiety and they feel helpless and hopeless. So this statistics is very important so that it establishes the effects or the impact that tinnitus is having on people. Because without this research, without these figures being out there, we might think that tinnitus is just maybe not existing because the number is not that such high and because it has not been classified as a very important factor to look at in the workplace. Now, 85.7% of the people that responded to this research says that they have sleep disturbance. So as a result of the tinnitus symptoms, they are not able to sleep properly. Then 68.4%, they reported low self-esteem. Low self-esteem means they think less of themselves because of their lack of concentration, because of the lack of sleep. So they are not able to perform adequately in their workplace or in their activities. So they have low self-esteem. Now, 54.9% of this statistics number says that they struggle to think rationally. So they don't have adequate thinking capacity. They feel that there's no need thinking anymore because they always feel disturbed. Their ear is always ringing and buzzing. So tinnitus is also linked to social isolation. So people having these tinnitus symptoms, some cases, they isolate themselves. This isolation will now impact their relationships, impact their daily lives, impact how they respond to people, how they take actions, how they behave. So that is what this tinnitus is, how it is affecting the people, affecting relationships. And in this situation, they avoid contacts, they avoid friends, they minimize social activities, they find it difficult concentrating at work. All impacts of tinnitus. So this Awareness Week is an eye-opener that brings up the opportunity for us health and safety professionals to blow the trumpet of how tinnitus is affecting life. And the worst part of it is that some of these impacts might not start immediately at work. It might not start immediately while the employee is still employed. It could start years later. It could start months later when the employee is already out of that workplace. And he'll start having this impact. He'll start having these symptoms. And at the end, in some companies or maybe some countries, he cannot get compensation. He cannot be able to prove his case as well. He can't prove that he had this impact or he had this situation coming because of the work he did at so time or so place. So that is why raising awareness of this tinnitus helps us to not just look at the reactive measures of what has happened, but try to let people know that this is the statistics, this is the number, this is what is going on. And you have opportunity now to prevent it. You have the opportunity now not to be counted as one of those numbers. So that is major impact of this Awareness Week, that we talk to the people, talk to the workers, talk to our employees, and let them understand that the tinnitus can be a case of anybody. Anybody can suffer from tinnitus, even though that you are not suffering from it now. But if you don't take proper proactive measures or preventive measures that you can be a part of this number in the near future. So that is why we have to take this awareness serious and take it to the grassroots. So why is this tinnitus awareness important? The first one is that it helps us to understand the cognitive and psychological impact it has. It helps us to propagate this message, let people know that these are the psychological impacts that tinnitus could have on anybody who starts experiencing these symptoms. And that will now help us to ensure that they take actions to avoid getting to that number. Another reason is that it helps in encouraging research. If we have the details, if people are aware of what is going on, then they can go and report. They can go to hospitals. And when medical facilities start having these numbers, then they urge to research for solutions, research for treatment, research for management skills and styles of tinnitus, then starts coming up. So this awareness will help to propagate the message of tinnitus existence, because lots of people could be in doubt. So people can attribute those ringing in ear to something else. They can attribute it to phone, they can attribute it to something else, but not realizing that this could be an impact that they had years ago in their workplace or where they used to worship. So another reason is that it helps to reduce stigma. Having this awareness and letting people know about tinnitus reduces the stigma. People, when you say that you are having ringing in the ear, people, they look at you somehow. They feel maybe you are lying, or they feel maybe something else is wrong with you. So if this awareness is open, if everybody knows about it, then the stigma will reduce. People will not stigmatize those who complain about tinnitus. They will not stigmatize those who has discomfort as a result of tinnitus. And they will not attribute it to spiritual things or maybe other things that are not related to the causes of tinnitus. Now, another reason is that it highlights the prevalence and diversity of the experiences. What this simply means is that if this awareness is known by everybody, if this awareness is expanded, then people will be able to know how many people are affected by this. We'll be able to know what could be the impact or what could be the causes of this. We'll be able to know the experiences that people suffering from these symptoms are passing through, their experience, how it has been for them. So this awareness, without this awareness, people can't be able to come out and share their experiences, which could also help others to avoid getting into that situation as well. Now, another reason is that it helps us to empower the individuals who are affected by tinnitus with adequate resources, maybe hearing aids, maybe training, maybe awareness, maybe information on how they can manage the tinnitus symptoms as well. So in the last slide, I'll talk about some of the steps that have been proven to be efficient in managing the symptoms of tinnitus. One of them is consulting the hearing care providers. So the hearing care providers, they will be able to evaluate the symptoms, understand what the individual is passing through, because the symptoms, the effects could vary based on individuals. So the hearing care providers will take time to evaluate the symptoms. They will identify the causes, and they will recommend tailored treatment like hearing aids or sound therapies or sound devices for that individual. So without that proper evaluation, you can't just diagnose yourself tinnitus and start doing any treatment or any management therapy. So you have to subject yourself to evaluation by a hearing care provider. So the next type of management that could be is Protection of your ear. When you are working in a workplace, ensure that you have proper ear protection. When you are at an event, ensure that you protect your ear from loud noise from sound speakers in the church, loud noise from speakers, wherever you may be, the blasting areas. If you work in a blasting site, those areas, they produce a lot of sound. So you have to take adequate actions to protect your ears. Keep your ears safe from infections. Ensure that your ears are well cleaned. Do not insert sharp objects into the ears. Do not try to induce wax removal from the ears in using the wrong means. So these measures that are required to protect your ear is what we need to propagate. Let people know that you need to take care of your ear because there is a medical condition known as tinnitus that could affect you if your ears are not properly taken care of. Then the other one that can be done is use of sound therapy. Sound therapy is a way of distracting that ringing, distracting that noise that comes, you experience in the ear, using a different types of sound, maybe a well soft sound, a soothing sound, or a type of a sound that are pleasing to the ear. So if you bring such type sound and keep it closer to your ear, that's the care provider will recommend. So it will be able to distract the ringing that you are feeling in your ear. So that is the system of use of sound therapy to manage tinnitus. It's not going to cure it. The ringing in the ear is not going to go away. It's not going to disappear because of this sound therapy. No, the sound therapy is a system that will help you to intentionally distract the sound that is coming from your ear with the other better soothing sound, which will help to elevate your mood, elevate your feelings, and remove your thoughts from the tinnitus effect. So this can be gotten with specialized devices that the hearing care provider will recommend. So another way of managing tinnitus is to manage stress, because stress will intensify the symptoms of tinnitus. So if you are having these symptoms of tinnitus, you are supposed to manage your stress. Ensure that all the stress inducers, the workload, those activities that induces stress, you try to manage them. Practice relaxation techniques like yoga, meditation, deep breathing. Put all measures in place to reduce your stress. So if your stress level is reduced, then your tinnitus will not be such audible as usual. But if you are stressed, if the stress level is very high, then it could amplify the tinnitus level as well. So in managing tinnitus, first you have to manage your stress. If your stress level is properly managed and reduced, then it will affect the level of the tinnitus. The sound level, the ringing in the ear that you'll be hearing will be inadvertently reduced because you are not stressed, because you are not tense, and because you are properly relaxed. Now, another way of managing tinnitus is to establish a sleeping routine. Sleeping routine is a system whereby you have a specified bedtime. Maybe you go to bed by 7 p.m. every day without fail. Immediately 7 p.m., you're already in the bed. So that is a type of sleeping routine that can then condition your mind, condition your brain that at also time you are at rest and you are asleep, then your tinnitus situation or your tinnitus symptoms could relax, could reduce at that particular time. And lack of sleep worsens the tinnitus symptoms. If you are not able to sleep for 2 days because of this symptom, then it could get worse. It could get more at a more alarming rate. So establishing a sleeping routine will help you to sleep better. And on sleeping better, then you are reducing the intensity of that tinnitus, and it could be reduced, because at the bedtime, it will be calm. Your environment will be calm, and your head and your brain will also be calm. So your ear and the ringing in the ear will be reduced as well. So you keep learning about like tinnitus, because tinnitus still have some developing effects and some developing factors that are not yet out there. Like there's no yet a treatment for it. It's just management. So there's still research going on. There's still questions being unraveled. There's still symptoms being developed as the time goes by. So staying alert, staying informed, reading about it, looking at the researches, looking at things that are going on at the moment will help anyone suffering from tinnitus to get up-to-date information. And in such doing, he will be able to take some actions that will be able to help him elevate his situation at that moment. So that is how to manage tinnitus. And that will be the end of my brief presentation, as I'm supposed to introduce the topic. So if any of us have any contribution or have any further information about this Tinnitus Awareness Week or the tinnitus itself, so you can share with us.
Yeah. Hello.
Hello, with you.
Yeah, thank you for the wonderful presentation. It's really eye-opener. I want to emphasize the fact that this is very important as it concerns our health. This tinnitus, if you have experienced, anyone has experienced uh, ear ache or ear pain or any sort of that, you will know that it's very discomforting, and in short, you cannot stand it. I will use myself as experience. I think here in Doha, I had ear ache one time. It was terrible. It was like my head was ringing. At the same time, I was, going crazy because of the ear. It was both combination of sound and scratch, and it's really something that you cannot just, when we are having an headache and you just want to get out of that headache, you take Panadol, you sleep. But with ear infection, it's even worse. So, but thank God when I went to the hospital and the doctor examined and the treatment was carried out and everything become normal. Then one thing, mine also, I discovered that when I use listening to music for a long time, because I was listening to music, loud music, with the headphone, and that is one also a contributing factor which contributed to my own problem at that time. And again, people seem not to understand when such campaign is being propagated to prevent this issue not coming up. People undermine, like we do a lot of scratching of our ears with even this ear, but trying to remove the wires and all that. This thing can cause effects, can open the door for if ear infection or even uh, aggravating the effect of tinnitus when you are exposed So loud sound in the workplace or in events or using the headphones, listening to music and all of that. So it's very important we take this kind of awareness topic very serious to take care of ourselves and tell those who we care for at the workplace as health and safety professional, even in our home or our personal uh, daily living. We should take care of our ear. Even when you are removing wax from your ear, there's a way to do it when you keep digging, you are destroying your eardrum. And when you are exposed to any kind of effect can lead to this temporary or permanent tinnitus. Maybe I could say I was having a temporary tinnitus at that time, coupled with other uh, ear infection. So since then, I've been very careful. Even when my wife is trying to remove some things from my ear, most time I would tell her, please leave it, because it gets me to remember the pains I've passed through before. So it's always I'm talking from a place of experience and what I've passed through in the past, and I wouldn't wish it for anybody. So anybody that I care about, I have to tell him or her this is serious. Like just recently at the workplace, we are working in a plant where there are a lot of noise, and I see some of my workers, even with the ear protection, they have the ear plug, they have the ear muff, but they are not using. So these are adults. I have to tell them, look, there's so people will always try to prove to you that the sound is not above the 85 decibel or that. So they're trying to bring up that. But believe me, in the course of this, the few time we spend in that plant, one or two persons drop off complaining of one ailment or the other. So after that guy was at the fair hit, I see that there was an improvement from their own self protections. They started using the AirP, started using their PP and all that. So I don't know why people always want to see that when there is an effect, a consequence before taking action. So this is uh, my own side, and I hope uh, we all uh, practice these things and try to also preach to people so that they can get to understand as we promote health and safety, trying to help one or two persons help ourselves. Thank you. Thank you.
Thank you very much. Thank you very much, Mr. Andrew, for that explanation and experience sharing. Surely they say that experience is the best teacher, but as health and safety professionals, our goal is majorly proactive, prevent it from happening before that experience. So, and learning from experience, that's other things that has happened, even if it didn't happen in our workplace or to us. We read about it, we learn from it, like the one you've explained now. So those are informations that we are learning from here and there, and it's our duty to pass them across. Communicate, communicate, communicate. Communication will go a long way in saving lives. All right, Mr. Johnson, go ahead.
Yeah, hello once again, everyone, and good evening. Johnson, thank you so much for your brilliant presentation, as always. I'm particularly interested in the survey you mentioned during your presentation that was carried out in the UK. So why I have particular interest in it is that I believe strongly that if such survey were to be carried out in Nigeria here, the result will be much more alarming. Many people unknowingly expose themselves to high levels of noise every day without them realizing it. Some will tell you they are used to it. And you know that is the beginning of getting deaf. By the time somebody tells you, oh no, I'm used to it, you know the person is already going deaf. Not too long ago, I went to a business center to go and process some documents. And they were running a generator. The noise of the generator was very, very high. Okay, it was the noise was high inside the shop, but not as much as it was outside. Now, the reason I decided to mention this is that not too far away, about 6 meters away from the generator, there was this young girl, a shopkeeper in a textile shop, sitting outside with this high noise there. So I had already walked past. And on the second thought, I said, no, let me talk to this girl. I think she doesn't know the effect of what she's exposing herself to. So I went back to her. I greeted her and told her that with this generator running like this, you cannot sit down here and your ears are not protected. That over time, you are going to become partially deaf. And you are a young girl, you are not even thinking of marriage yet. If this goes on for a long time, you'll be surprised that when your husband is going to talk to you in the future, you'll be making him to almost repeat every word he says. That is because your hearing ability has been reduced because of the noise we are supposed to hear. And you will not know where it comes from or it came from. And she was very appreciative. She thanked me so much. She told me that she doesn't have anything she can she can use to cover her ear. I told her that, okay, she should get a toilet roll, pull a short length of it out, squeeze it to become very small, and push it in the ear. One on one ear and another one on the other ear. That one will douse the effect of the noise in your ear. Kind of improvised hearing protection. So there are so many people that are exposed to this kind of noise every day in the course of doing their daily business. Also, I mentioned it the other time when the day we had a presentation on a noise. I mentioned that I have a friend who became deaf in one of his ears on the day of his marriage. And that's because he was sitting very close to the musician's loudspeaker. And the sound level was turned so high that that one was immediate effect. He became deaf at the end of that marriage. He couldn't hear from that ear. So now till now, he hears with only one ear. There were so many churches that will set their musical equipment volume very high and be blaring at top volume, believing that is the only way that God can hear their praises and prayers. They don't know what level of damage they are doing to themselves. Years ago, when we used to worship in a particular church in Ikeja that way, I always avoided sitting close to the altar because the musical equipment sound level was very, very high. And of course, my wife knows it. So if we come around and there are no seats from middle of the road to back, we'll stand at the back, but we will not go to the front to go and sit down with that kind of a high level of noise. So thank you so much for bringing this topic. And something I just want to add from personal experiences that when it comes to cleaning of removal of wax from the ear, some people sometimes use a match stick. The left side of it, they will put it in their ear and use it to remove the wax. That is a very, very dangerous thing to do. If you see anyone doing it, don't even waste a second to stop him. Because the lead in the match reacts with the wax in the ear and immediately it causes serious infection. And if it is not urgently treated, it can lead to outright deafness. In fact, it doesn't take long. If the person does it in the morning, before evening, he has started experiencing something in the around the ear, outside. And by the following day, the affected ear, there will be swollen. There will be a swell around the ear with pain. So it is a very, very dangerous thing to do. Anybody should not try it at all. So once again, thank you so much for picking this topic.
Thank you very much, Mr. Jackson. We really appreciate your time and your energy in contributing to our topics. We really appreciate.
Thank you.
Thank you very much.
Yeah.
So, without wasting much of our time, I want to appreciate us for joining today. It was an impactful time, despite the number of people that attended, but we made a very huge impact. So thank you guys for coming, and see you next week.